This is Pack 365, myself Srija. So today in this session, you are going to learn about the ICD-10-CM coding for diseases of the musculoskeletal system. So in this session, you are going to learn like how the ICD-10 codes are classified and how the disease of the musculoskeletal system are classified into different codes and subcodes. So first, understanding the musculoskeletal system. So musculoskeletal system is a structural and movement framework of the body. So it includes bones, joints, muscles, tendons, ligaments, cartilage, and connective tissues. So why the system is important? So it enables the movement like walking, lifting, and bending. It maintains the posture. It provides the protection like protecting the lungs and heart. It gives shape to the body. It stores the minerals like calcium. It also produces the blood cells in the bone marrow. So why any part of the system is damaged by injury or infection or degeneration or also the autoimmune diseases, ICD-10-CM uses a specific set of codes, that is M00 to M99 code ranges, to identify and document these conditions. So chapter 13 is organized mainly by the type of joint or musculoskeletal disorder. So in this ICD-10-CM chapters, these injuries are mainly classified into the following chapters. So what are those? Like M00 to M03. So breakdown of the subsections. M00 to M03, it's a infectious arthropathies. So what do you mean by infectious arthropathies? So these are the joint infections usually caused by the bacteria, viruses or fungi. For example, septic arthritis, post-infective arthritis. So these conditions need urgent treatment because the joint infection can destroy the cartilage quickly. So M05 to M14 code range describes about the inflammatory polyarthropathies. Nothing but this involves the inflammation of the multiple joints, often due to autoimmune diseases. So most of the common examples include here is rheumatoid arthritis, gout and psoriatic arthritis. So polyarthropathy also include in this. So what do you mean by the term polyarthropathy? Poly means many, ortho means joint, plus pathy is a disease. So these are typically chronic, systemic and require long-term management. So M15 to M19 is for osteoarthritis. So this is the most common joint disease, especially in the older adults. So in this you can see the primary osteoarthritis and secondary osteoarthritis of knee, hip, hand, spine, etc. So what are the characteristics of osteoarthritis? So it's a degeneration of cartilage. You can see the formation of bone spurs and pain worsens with the activity. So what is the code range M20 to M25? It describes about the other joint disorders. Nothing but this category includes all the other joint conditions which are not caused by the infection, inflammation or the osteoarthritis. So some of the examples which include like joint deformities, so joint instability, loose body in joint and also joint dearrangements. So these codes are commonly used for the orthopedic injuries, sports medicine and also the post-trauma conditions. So next is M30 to M36 and this covers the systematic connecting tissue disorders. So disorders, they affect the body-wide connective tissues, meaning they can involve the joints, skin, blood vessels and also the internal organs. And then M40 to M54, dorsopathies, also called as spine disorders. So these codes, they cover the conditions affecting the spine, including deformities, degeneration and also the back pain conditions. So again M40 to M43 code range, they includes the deforming dorsopathies. Nothing but these include the structural deformities of the spine, for example scoliosis, kyphosis, lordosis. So M45 code range to M49, they describe say spondylopathies. So spondylo, it refers to vertebrae. So these are among the most commonly coded spine conditions in orthopedics. So next M50 to M54. So this includes other dorsopathies. So this includes the common back pain conditions. Whereas M60 to M79 code ranges, they include the soft tissue disorders, So these include, the soft tissues include muscles, fascia, tendons, ligaments, bursae, and also the related structures. So M60 to M63, they describe about the disorders of the muscles. So these include the inflammation, tears, and degeneration. For example, myositis, myopathy, and also the muscle strain. So M65 to M66, so 65 to 67, they describe about the disorders of synovium and tendon. So synovium is nothing but it's a lining inside the joints, whereas tendon, it connects muscle to the bone. So these codes are heavily used in the hand injuries, sports clinics, and also rheumatology. So M70 to M79, this includes other soft tissue disorders. So this includes remaining soft tissue issues. So for example, fibromyalgia, soft tissue pain, and also enthesopathy. So next, M80 to M94 code ranges, they include the osteopathies and chondropathies. Osteo is nothing but bone diseases, and chondropathies means the disease of the cartilages. So M80 code range to M82, they describe about osteoporosis and also the related disorders. So this distinguish between without fracture, important for coding accuracy. And then M83 to M94 code ranges, they include about the bone or cartilage disorders, nothing but these includes abnormal bone growth, cartilage diseases, and also the bone necrosis. For example, osteomalacia, softening of the bones, and also osteochondritis. So the last code range M90 to M95 to M99, they describe about the other disorders. So these are the miscellaneous conditions which are not included in the previous sections. For example, acquired deformities of the musculoskeletal structure. So now let's go into brief discussion about each and every code with example. So coming to M00 to M03 codes, infectious arthropathies. So these codes, they describe about the joint disorders which is caused by the infection. So infectious arthritis is an emergency because bacteria can destroy a joint within hours to days. So the first code range is M00 to M03, and this include M00, M01, and M02. So coming to M00. So what is the code description for M00? It's a pyogenic arthritis. So this is a bacterial infection which is inside a joint, often called as septic arthritis. So how it happens? So bacteria, they travel to joint via bloodstream, nearby infection, or open wound or surgery. So what will be the symptoms of pyogenic arthritis? There may be a severe pain, swelling, warmth and redness, fever, and also difficulty in moving the joint. So what are the important subcodes for M00 category? M00.1 for pneumococcal arthritis, so which is caused by the Streptococcus pneumoniae organism. So for example, M00.061, it describes about the staphylococcal arthritis in the right knee. So whenever staphylococcus arthritis right knee is diagnosed in the patient's record, you must assign the code M00.061. So next, coming to M01. M01 is a direct infectious arthritis. So here the joint infection is caused directly by a known infectious disease. So these causes, they include the tuberculosis, viral infections, Lyme disease, and also the fungal infections. So these infections, they spread from the disease process into the joint. So for example, it's M01.X2, tuberculosis arthritis. So this is different from the M00, so which is usually caused by bacteria entering the joint from outer side. So next, coming to M02. So M02, it describes about reactive arthropathy. So this is also known as the post-infectious arthritis. So the joint is not infected, but the immune system reacts to an infection that happened elsewhere in the body. So what are the common triggers here? GI infections, urinary tract infections, and also the post-viral infections. So these appear 1 to 4 weeks after the infection. They usually affect knees, ankles, or feet. Now here you can clearly see a picture of Septic arthritis nothing but pyogenic arthritis, and this is a healthy knee joint. This is a septic arthritis of the knee joint. So in a healthy knee joint, you can see bone, articular capsule, smooth articular cartilage, synovial fluid, synovial membrane. So what is the purpose? It demonstrates normal and non-inflamed joint. So coming to septic arthritis of knee joint, it shows the red and swollen joint cavity clearly in the picture. It has a thick pus-like fluid, and you can see the inflamed synovium and also bacterial overgrowth on the knee joint. So it illustrates the destructive effect of bacterial infection inside the joint. So this infectious arthritis, they requires immediate treatment because of the drainage and also the fourth antibiotics. So laterality and organism specific codes improve coding accuracy. You should understand the difference between the direct infection versus the reactive inflammation. So next coming to the M02 subcodes. So M02, let's break this slide into two main sections, post-infective and reactive arthritis, M02 to M03. So M02, it's a reactive arthropathy. Reactive arthropathy, it occurs after an infection elsewhere in the body, but the joint itself is not selected. So how the subcodes are classified now? M02.1 for post-dysenteric reactive arthritis, post-dicentric and post-infective. So M02.1, it's triggered by the gastrointestinal infections like Shigella, Salmonella and Campylobacter. Whereas M02.3, it is a post-infective reactive arthritis. So a general category for the joint inflammation after any infection. So what is the example? M02.30, the post-infective arthritis, it's an unspecified site. So this is used whenever the exact joint is not specified. So this reactive arthritis, it is commonly involves the knees, ankles and feet, appearing 1 to 4 weeks after an infection. So next is M03, it's a post-infective arthropathy. So what do you mean by post-infective arthropathy? This refers to the chronic joint points or chronic joint problems that remain after a previous infection. So even when the infection is already cured. So for example, M03.80 for post-infective arthritis, multiple sites. So this is used whenever the multiple joints are affected after a healed infection. So next, M05 to M14 code ranges. What they describe? The inflammatory polyarthropathies. So this section includes the diseases that causes the inflammation in the multiple joints, usually due to autoimmune or the systemic conditions. So a key category inside this is rheumatoid arthritis. So rheumatoid arthritis, it's a chronic autoimmune condition where the immune system attacks the synovial membrane, that is nothing but the lining of the joint. So what does this causes? It causes a synovial inflammation, cartilage destruction, bone erosion and also the joint deformity. So what are the subcodes? M06.0 for seronegative RA. Nothing but RF is absent in the blood test. So when we take an example, M05.79, it describes about the rheumatoid arthritis with RF rheumatoid factor plus multiple sides. So at the right side, you can clearly see the picture of the rheumatoid arthritis. This is a healthy joint. This is a rheumatoid arthritis joint. So here you can see a smooth cartilage, normal synovial membrane, clear joint space, and there is no swelling. Whereas in rheumatoid arthritis joint picture, you can see the swollen, thickened synovial membrane. So erosion of bone surfaces also takes place and cartilage wearing away and narrow joint space is present in this rheumatoid arthritis. So next to rheumatoid arthritis, we have M07, the psoriatic and enteropathic arthritis. So what do you mean by it? These groups includes arthritis associated with the psoriasis, bowel diseases. So psoriasis, it's an autoimmune skin disease. It leads to chronic joint inflammation. Usually it affects fingers or toes, which leads to sausage digits or dactylities. So nail changes like fitting, lifting, and cracking, and also asymmetrical joint involvement. So what are the bowel diseases? They seen with the Crohn's disease and ulcerative colitis. So these patients may have bowel flare-ups along with the joint pain. For example, when we take M07.30, so it is psoriatic arthritis unspecified. So whenever psoriatic arthritis is diagnosed by the patient or diagnosed in the patient's record, you must apply the code, you must assign the code from the M codes, M ranges series. So right side you can see the picture of post psoriatic arthritis, the top picture, and this image shows the swollen deep joints, red inflamed joints, nail changes, the lifting, streaking, and cracking, and asymmetrical swelling and chronic inflammation extending from skin plaques to joints. So this helps the students visualize how psoriasis and joint inflammation is coexisted. So next code is M10. It describes about the gout. So what is gout? It is a joint inflammation caused by the uric acid crystals deposited in the joints. So why it happens? When a high uric acid is present in the blood. So when crystals trigger the severe inflammation. So by this the gout happens. So what are the symptoms of the gout? You can see the sudden and intense pain, redness and warmth, and often it attack affects the big toe. That is the first MTP joint. So what are the subcodes of gout? M10.0 for idiopathic gout. Idiopathic gout is nothing but the cause is not already known. So the next code is M10.3, gout due to renal impairment. So kidneys cannot remove uric acid crystals and also the crystals. For example, when you assign M10.071, you describe about the idiopathic gout about the right angle. So in the right side, you can clearly see the picture of the gout. So this image shows uric acid crystals in the joint. So it shows a severe inflammation in the big toe and redness, swelling and intense pain, and also the healthy toe versus gout affected toe comparison. So this is about the M10, 7 and M10 code ranges. So next coming to M13 and M14. So these categories, they includes the arthritis forms which are not classified elsewhere. So what will be the examples? Like juvenile arthritis, nothing but which is present in the children. And then M15 to M19 code ranges, they describe about the osteoarthritis OA. So what do you mean by osteoarthritis? It's a degeneration, wear and tear of joints come on with the age or overuse. So what do you experience? What are the key features of this one? A loss of cartilage, bone spur formation like osteophytes, and morning stiffness less than 30 minutes. So pain versus with the activity. So M16 M16 is osteoarthritis of the hip. So a major category inside the M15 and M19 are the futures. What are the futures of this one? The hip cartilage wears down over time. They causes the stiffness, decreased range of the motion, pain in the groin, thick or buttock, and also it is very common in the older adults or the after injuries. So M22, M25 is a continuation. So this describes about the other joint disorders. So this section of isolated CM, they include the joint problems that are not caused by infection, autoimmune disease, gout or osteoarthritis. So these are mainly structural deformities, movement problems and also the mechanical tissue of the joints. So the M20 finger is finger or toe deformities. So these are acquired deformities which is not congenital. So they commonly involve the toes, especially due to the footwear trauma or arthritis. So what is the example of the conditions under M20? Hallux valgus. So it describes about the deviation of the big toe towards the other toes, nothing but the common B union deformity. So the next is, what is the example of E20? hallux valgus, which is unspecified, and it is used when not specified as the right, left, or bilateral. So you have to show students images of the normal versus hallux valgus to help them to visualize deformity. And coming to M16, it describes about the osteoarthritis of the hip. So this is a review from the upper slide. So what are the subcodes over here? M16.0 and M16.11. So QA means degeneration changes due to aging or wear and tear. So next is M17. So what code, how it is described? M17 is osteoarthritis of the knee. So this shows knee cartilage degeneration, which is leading to pain, stiffness, and also the reduced mobility. So what is the example? M17.11, which is a primary osteoarthritis, right knee. So next is M19. It's other and unspecified QA. So this QA, it occurs in joints other than hip or knee, for example, wrist and shoulder. So the physician does not specify the location precisely. So category M20 to M25. So this describe about the other joint disorders. So this is a broad group which is covering the structural joint deformities, instability, stiffness, joint effusions, and also the mechanical dearrangements. So here you can see the pictures of hip joint osteoarthritis, healthy knee joint, and also the osteoarthritic knee. So healthy hip joint, it is a smooth round head of the femur. So healthy cartilage covering the joint surfaces. So this joint space is normal, no extra bone growth. So what do you, so it's a hip joint with osteoarthritis together. It helps in the degeneration of the cartilage. Nothing but the smooth cartilage becomes thin and rough. So reduced joint space due to cartilage loss, and osteophytes appear around the joint edges. So movement becomes painful and also stiff because bones start rubbing directly. So this is a healthy knee joint. This is a osteoarthritic knee joint. So in this you can see the smooth cartilage covers the femur and also tibia. It has a normal align or normal joint space, the bones align properly, and there is no inflammation or the bone growth. Whereas osteoarthritic knee, this right image shows the classic OA changes. So it results in the degenerated articular cartilage, nothing but it is worn down and spurring the femur bone, also called as the osteophytes. So these are the extra bone growth at the edges, and also the narrow jointed space which bones comes closer as cartilage thins, and also pain, stiffness, swelling occur because of a joint becomes rough and inflamed. So next slide, M23. It's an internal dearrangement of a knee. So what do you mean by the internal dearrangement of knee? So this course they describe the mechanical problems inside the knee joint, usually involving the meniscus or loose fragments inside the joint. So what are the common internal dearrangements include? It includes meniscal tear, loose body in the joint, ligament injuries contributing to the instability. So what is the example of the medial meniscus tear? M23.21. So it's an example. So you have to assign the code M23.21 whenever a medial meniscus tear right knee is diagnosed within the patient record. So on the right side of your slide, you can see a normal meniscus versus the torn meniscus, and you can also see the bucket handle meniscus and the radial handle tear. So normal meniscus, it's a smooth C-shaped cartilage, whereas bucket-handled tear, it's a large displaced tear, and torn meniscus, it cracks or split in the cartilage, whereas the radial tear, it starts from the inner edge. So M25, it describes about the other joint disorders. So this covers non-specific symptoms which are related to the joints, not due to a known disease. So what are the subcodes over here? M25.4 for effusion, M25.5 for joint pain, and M25.6 for stiffness. So effusion is nothing but the fluid inside the joint is swelling. So joint pain most commonly used when the cause is unclear. And stiffness means a limitation in the movement. For example, if you take M25.561 code, it describes about the pain in the right knee. So here you can see the picture of the hallux valgus in the right side. So this shows the deformity of the big toe where the toe tilts the sideways. So the bump at the base of the big toe is called as the B union. B union. So this is often caused by the tight footwear, flat feet, and also the family history. So next coming to the M30 to M36 code ranges, which describes about the connective tissue disorders. So these conditions, they involve the inflammation of the tissues like ligaments, skin, blood vessels, and organs. So what is the code? M32 for systemic lupus erythematosus, nothing but shortcut SLE. So a multi-system autoimmune disease where the immune system attacks our joints, skin, kidneys, blood cells, heart, and lungs. So for example, if you take M32.10 isolated CM code, it describes about the SLE with the organ involvement. So the symptoms may include the joint pain and swelling, butterfly rash on the face, fatigue, and also the kidney problems. So this is about the M33, M34, and M35 codes. So what are these code ranges? They describe about the connective tissue disorders. So this slide explains three major groups of autoimmune connective tissue disorders. So these diseases, they often affect the muscle, skin, and internal organs. So coming to M33 code, it describes about the dermatomyositis and also polymyositis. So what are these conditions? So they are the inflammatory muscle diseases. So they can cause muscle weakness, especially in the shoulders and lips. So dermatomyositis, it also includes a skin rash, while polymyositis does not include a skin rash. So why this happens? So the immune system mistakenly attacks its own muscles. So in the picture you can clearly see right side, it shows a classic pulpal rash on eyelids called heliotrope rash, and this hand image, it shows us the Gottron papules, which are pink or purple bumps on the nipples. So what is the example for this one? M33.20. It describes a polymyositis. So you have to assign this M33.20 ICD-10-CM code for polymyositis. So next coming to code M34, it's systemic sclerosis, which is also called as scleroderma. So what it is? It is a chronic autoimmune disease that causes the hardening and thickening of the skin, and sometimes it also affects the organs like the lungs and kidneys. So scleroderma means a hard skin. What is the example? M34.0, which describes the progressive systemic sclerosis. So next is M35, the other connective tissue disorders. So this category includes several autoimmune conditions such as Sjogren syndrome. So what do you mean by Sjogren syndrome? The immune system, it attacks the glands that produces the tears and saliva. So it leads to very dry eyes and mouth. So here you can clearly see the picture. Image of an eye showing the swollen and inflamed tear gland. So red irritated surface and also gritty sensation and dryness. So this is the mixed connective tissue diseases. They overlap these other syndromes. They are the features of multiple autoimmune diseases. So this is about the Sjogren syndrome, and this is the scleroderma picture. You can clearly see it. You can clearly see the thickened skin, the painful calcium bumps over here, and also the Raynaud syndrome. So that's it, guys. This is about today's session. In the next session, you will be learning about the continuation of this ICD-10-CM classification. Thank you.